Welcome back to the deep dive. We've gotten a lot of requests to take a closer look at the thyroid gland.
Oh, yeah.
So that's what we're going to do today. We're going to do a deep dive into the thyroid gland.
Right on.
And, it's a gland that a lot of people, I don't think, really think about too much.
Yep.
But it plays a really, really big role in our overall health.
Oh, absolutely.
And you've mentioned wanting to know more about it, like how it impacts energy levels and metabolism and even mood.
Mm-hmm.
So that's what we're going to be talking about today.
Okay, great.
And it's pretty fascinating, all the research that's been done on this tiny but mighty gland.
Yeah, it really is. It's amazing how such a little gland can just have these huge effects on your body,
Yeah, so first things first.
Okay.
Where is this thing?
Well, it's right in your neck.
In my neck.
Yeah, so if you were to kind of gently touch the front of your neck, right on your windpipe, just below your Adam's apple, you would find it there.
Okay.
And it's shaped like a butterfly.
Oh, I've heard that.
Yeah, with two lobes connected by a thin band of tissue called the isthmus.
Okay.
And get this, it's the largest gland in your body that's just completely dedicated to making hormones.
The largest, really?
Yeah, it's the largest pure endocrine gland.
Wow, I did not know that.
It's pretty amazing, right? And it gets a ton of blood flow.
Oh, wow.
That's one of the reasons why thyroid surgery can be pretty tricky for surgeons.
Oh, I bet, yeah.
Yeah, there are a lot of blood vessels in there.
So we've got this butterfly-shaped gland
Right.
pumping out hormones.
Hmm.
What's going on inside of it?
Well, picture this. It's kind of like a honeycomb
Okay.
with all these tiny spherical structures called follicles.
Follicles?
Yeah, they're like little factories churning out thyroid hormone.
Okay.
And these follicles, they're filled with this sticky substance called colloid.
Oh, colloid. I've heard of that.
Yeah, think of it like the storage unit for thyroid hormone.
So it's like a warehouse.
Wait, exactly, a hormone warehouse.
So we've got all these follicles packed with hormone reserve, but how does it actually get made?
How does it get made? Ah, that's where the magic happens. Think of the thyroid as a master chef, carefully combining ingredients to create a powerful recipe. And what's the star ingredient? It's iodine.
Iodine.
Yeah, so the thyroid actually gathers iodine from your blood, kind of like going shopping for the perfect ingredient.
Oh, interesting.
Yeah, and then it brings that iodine inside those follicles and mixes it with a protein called thyroglobulin.
Thyroglobulin. Okay.
Yeah, it's kind of like prepping the ingredients before mixing them together to make the final hormone.
Okay, so you need iodine to make thyroid hormone.
Absolutely. Iodine is essential.
So what happens if we don't get enough in our diet?
Well, that's a great question. That can lead to something called goiter.
Oh, yeah, goiter.
Yeah, where the thyroid gland swells up
Swells up.
because it's trying to work harder to get that iodine.
So it's like it's compensating?
Exactly. It's trying to compensate for that lack of iodine. Back in the day, there were actually regions called goiter belts.
Goiter belts, wow.
Where iodine deficiency was so common that a lot of people would have visibly swollen necks.
That's crazy.
Yeah, it was a big problem.
Thankfully, we've got iodized salt now, right?
Exactly. That helps a ton
Yeah.
in preventing iodine deficiency and all those problems that come with it.
It's amazing how such a simple thing can make a big difference.
It really is. But, it's still important to be mindful of iodine intake, especially for pregnant women.
Oh, yeah.
Because even mild iodine deficiency during pregnancy can really affect a child's development.
Wow, how so?
While studies have shown that it can actually lower a child's IQ by several points.
Really? Wow, I had no idea the impact was that significant.
Yeah, it's pretty amazing how much this one element can affect us.
So we've talked about the thyroid collecting iodine
All right.
and prepping the ingredients.
Yes.
But how does it actually assemble them into the final hormone product?
Okay, so inside those follicles, the thyroid takes the iodine and combines it with the thyroglobulin
Right.
to form two main types of thyroid hormone, T4 and T3.
T4 and T3.
Yeah, and you can think of T4 like the storage form and T3 as the active form.
Oh, okay.
And a thyroid mostly releases T4 into the bloodstream, and then the body can convert T4 into T3 as needed.
Okay, so it's like having a reserve tank of fuel that can be converted to usable energy when necessary.
Exactly. That's a great way to think about it.
Very cool. Now, how does the hormone actually work in the body?
That's where things get really interesting. You see, unlike a lot of hormones that work by binding to receptors on the outside of cells, thyroid hormone actually goes right into the cell,
Into the cell.
right into the nucleus where our DNA is.
Wow, VIP access.
I know, right?
Yeah.
Most hormones just deliver their message at the cell's front door, but thyroid hormone, it goes straight to the control center.
Okay, what happens then?
Once inside, It binds to specific receptors
Mm-hmm.
and acts like a switch, turning certain genes on or off.
So it's controlling our genes.
In a way, yes. It's influencing what proteins get made, which ultimately affects how our cells function and all those different bodily functions. It's like having a key that can unlock specific instructions in our DNA blueprint.
So it's like a master regulator.
Exactly.
Pretty powerful stuff for such a tiny hormone.
It really is. And you're right, it affects so much.
Mm-hmm.
From metabolism to growth and development to even keeping our blood pressure in check.
It's amazing. So let's break it down a bit. How does thyroid hormone affect our metabolism specifically?
Okay, so thyroid hormone is basically what revs up our metabolism, which is the process of converting food into energy.
Right.
So this not only affects how many calories we burn at rest,
Mm-hmm.
but it also affects our body temperature. Have you ever noticed that people with an underactive thyroid often feel cold?
That's true, yeah. Like their internal furnace is running low.
Exactly. That's because thyroid hormone is what helps keep that furnace going.
Okay, so that's metabolism. What about growth and development? We talked about its importance during pregnancy, but what about its role in childhood and beyond?
Oh, it's essential for normal development of the brain and the skeletal system, especially when we're kids.
Mm,
Think of it as the fuel for growth,
that makes sense.
That's actually why newborns are routinely screened for their thyroid hormone levels.
Oh, okay.
Because catching any deficiencies early on is really important to prevent developmental delays.
Right. Wow, so important.
It is, it is.
Okay, now I'm curious about how thyroid hormone regulates blood pressure.
You got it. So essentially what it does is it increases the sensitivity of our blood vessels
Okay.
to adrenaline and noradrenaline.
Those are our fight or flight hormones.
Exactly. So by doing that, it kind of fine-tunes our blood pressure response.
So make sure everything's running smoothly.
Exactly. Keeping the cardiovascular system in check.
No, we've talked about how the thyroid stores these large quantities of hormone.
Right.
How does it know when to release those reserves?
Ah, great question. So the thyroid doesn't just work on its own. It's actually part of this really sophisticated feedback loop
Oh, okay.
that involves the pituitary gland.
Which is?
It's a tiny gland in the brain.
Okay.
And the pituitary releases a hormone called TSH,
TSH.
which stands for thyroid stimulating hormone. Think of TSH as the messenger that tells the thyroid, hey, we need more thyroid hormone.
Oh, so the pituitary is like the boss.
Kinda, yeah. It keeps tabs on our thyroid hormone levels and sends out instructions as needed.
Makes sense. So what happens when the pituitary senses that our thyroid hormone levels are low?
Well, when that TSH from the pituitary binds to the receptors on the thyroid gland,
Mm-hmm.
it triggers a couple of things. First, it tells the thyroid to release some of the stored hormone into the bloodstream, like, okay, time to share.
Okay.
And then second, it tells the thyroid to make more hormone.
Oh, to restock, right.
Exactly, to replenish those reserves. So it's a two-pronged approach.
Very cool. So it's constantly monitoring supply and demand, making sure everything is balanced.
Exactly. But there's more to this story. You see, there's this other feedback mechanism that actually prevents the thyroid from overproducing hormone.
Oh, that makes sense. You don't want it to go overboard.
Exactly.
Right.
So when the thyroid hormone levels in the blood start to rise, they send a signal back to the pituitary gland and the hypothalamus, which is another area in the brain.
Okay.
And they say, hey, ease up on the TSH production.
Oh, so it's like a thermostat.
Exactly.
Yeah.
When the room gets too warm, it shuts off the heater.
Right.
Same idea here. This negative feedback loop helps keep our thyroid hormone levels in that sweet spot,
Okay.
preventing both deficiencies and excesses. But of course, there are other things that can affect this whole delicate balance.
Like what?
Well, remember how we talked about thyroid hormone regulating body temperature?
Yeah?
Well, being exposed to cold can actually trigger the release of another hormone,
Okay.
TRH, from the hypothalamus.
TRH.
Yeah, and that tells the pituitary to release more TSH.
Okay.
And ultimately, that leads to more thyroid hormone production to keep us warm.
So bundling up when it's cold could give my thyroid a workout.
Ah, you can see that.
Interesting. And I'm guessing stress plays a role too.
You bet. High levels of cortisol, which is our stress hormone,
Mm-hmm.
can actually suppress thyroid hormone production.
Oh, really?
Yeah, it's like our body is focusing on dealing with that immediate threat and putting other functions on hold.
That makes sense. Yeah. Survival mode.
Exactly. So yeah, we've got cold exposure revving things up, stress possibly putting on the brakes.
Mhm.
Oh, and here's an interesting one.
Okay. Lay it on me.
High levels of iodine in the blood can actually temporarily stop thyroid hormone from being released.
Wait, really? I always thought more iodine was better for thyroid health.
Well, like most things in the body, it's all about balance.
Right.
Iodine is essential, but too much of it can overload the system.
Yeah, like over-fertilizing a plant.
Exactly. Sometimes too much of a good thing can backfire.
Okay, so we've got this really complex system of checks and balances.
It is. It is.
So what happens when those checks and balances go haywire? What happens when the thyroid isn't functioning right?
Well, that's when we start to see problems.
Mm-hmm.
We can either have too much thyroid hormone,
Too much?
which is called hyperthyroidism,
Hyperthyroidism, okay?
or too little.
Which is hypothyroidism.
Exactly. And both of these conditions can have a big impact on our health.
So those are the things we're going to be discussing in detail when we come back.
That's right. We'll dive deeper into the problems that can arise when the thyroid isn't functioning as it should.
Sounds good. Stay tuned.
All right.
Okay, so let's get back to our deep dive on the thyroid gland.
Right.
And as we were saying before the break, when that delicate balance of the thyroid gets disrupted, it can really cause problems.
You really can.
So let's start by talking about hypothyroidism,
Okay.
which is when the thyroid isn't making enough hormone.
Right.
So what's actually happening in the body in those cases?
Okay, so imagine this. Your body's metabolism is like running in slow motion.
Slow motion.
Yeah, like everything's just sluggish, like a car trying to go uphill with a weak engine.
Yeah, I can picture that.
Yeah, so you might constantly feel cold, your digestion gets all messed up and you have no energy.
Hmm.
It's like both your body and your mind just feel drained.
So it affects both physical and mental energy.
Oh yeah, absolutely. And in really severe cases, it's actually called myxedema.
Myxedema, what's that?
Well, it's basically the full-blown hypothyroid syndrome in adults.
Oh, wow.
Yeah, and it can cause some pretty noticeable changes in your appearance too.
Like what?
Well, one of the big things is changes in the skin.
The skin.
Yeah, it can become really dry and rough, almost leathery in texture.
Oh, wow.
And there's often a lot of swelling, especially around the face, like in the eyelids.
Yeah.
That's actually where the term myxedema comes from. It means mucus swelling.
Oh, interesting. So I've got the low energy, feeling cold, constipation, skin changes, mental fogginess.
Yeah,
Sounds pretty rough.
it is. It's like a whole body slowdown.
What causes this to happen? Is it always just because of a lack of iodine?
Not always, no.
Hmm.
Iodine deficiency can lead to hypothyroidism, that's true.
Mm-hmm.
But there are actually several other things that can cause it.
Oh, really?
Yeah, sometimes the thyroid gland itself is the problem, like it just can't produce enough hormone, even with enough iodine.
Oh, so it's malfunctioning.
Right, exactly. And sometimes the issue is actually with the pituitary gland.
Okay.
If it's not sending out enough TSH, that hormone we talked about,
Right.
the thyroid won't get the message to make more hormone.
Oh, so it could be a problem with the thyroid itself or with the messaging system.
Exactly. That's a great way to put it.
Wow. Are there different types of hypothyroidism?
Yes, absolutely. One of the most common types is called Hashimoto's thyroiditis.
Hashimoto's thyroiditis?
Yep, it's an autoimmune disorder.
Autoimmune?
Yeah, meaning
Yeah.
the body's immune system is attacking its own tissues, in this case, the thyroid gland.
Oh, so the body's attacking itself.
Yeah, it's like its defense system gets confused and starts targeting its own team.
Wow.
And over time, that can actually destroy the thyroid's ability to make hormones.
So it's not a quick thing. This is something that happens gradually.
Right, exactly. It's a chronic condition.
Okay, so that's Hashimoto's thyroiditis. What are some other common types?
Well, there's postpartum thyroiditis.
Postpartum, so after childbirth?
Exactly. It can affect women after they give birth.
Mm-hmm.
And it's thought to be triggered by those hormonal shifts and immune system changes that happen during pregnancy.
That makes sense.
Yeah, it's kind of interesting, actually.
Wow, yeah, how so?
What often starts with a really brief hyperthyroid phase.
Really? So like too much hormone?
Yeah, because the thyroid is releasing all this stored hormone,
Yeah.
but then it's followed by the hypothyroid phase.
So it's like a roller coaster.
Right, exactly. Up and then down. It's thought to be because of inflammation that happens in the thyroid after childbirth.
So the thyroid can go through a lot during pregnancy and after childbirth.
Definitely, it's a wild ride for the thyroid.
Now, if someone has hypothyroidism, what happens if they don't get treatment for it? What are the long-term risks?
That's a good question, and it's important to understand that untreated hypothyroidism can lead to a whole bunch of problems.
Like what?
Well, it can increase the risk of heart disease, infertility, joint pain, even depression.
Wow, so it's not something to take lightly.
No, absolutely not.
Yeah.
It really needs to be addressed.
Okay, so how do you actually treat someone with hypothyroidism?
The most common treatment is actually pretty straightforward. It's called thyroid hormone replacement therapy.
thyroid hormone replacement, so you're just giving them the hormone they're missing.
Exactly. It's basically a synthetic form of thyroid hormone.
A synthetic version.
Yeah, just to supplement what the body isn't making enough of.
So you're giving the body a little boost.
Exactly. Helping it get back to that balance we talked about.
Okay, that makes sense. Now let's switch gears and talk about the other side of the coin.
Okay.
Hyperthyroidism.
Right.
When the thyroid is making too much hormone,
Too much. Yeah.
what happens then?
It's like your body's stuck in fast forward.
Fast forward.
Yeah, everything
Yeah.
speeds up. Your metabolism goes into overdrive.
Yeah.
Your heart races. You feel anxious and shaky, and you can't sleep.
So it's like the body is constantly on high alert.
Yeah, exactly. Like it's stuck in fight or flight mode all the time.
And what causes this overproduction of thyroid hormone? What are some of the common culprits?
Well, one of the biggest ones is Graves' disease.
Graves' disease, that's an autoimmune disorder, right?
You got it. It's the one we mentioned earlier where the immune system is attacking the thyroid, but in this case,
Yeah.
it produces these antibodies that actually mimic TSH.
So it's sending out false signals.
Exactly. Those antibodies are basically tricking the thyroid into producing way more hormone than it needs.
Even though the body already has enough.
Right. Exactly. The immune system is just sending out those make more signals nonstop.
Oh, wow. Besides the symptoms we just talked about, are there any other telltale signs of Graves' disease?
Yeah, one of the classic signs is exophthalmos.
Exophthalmos.
Yeah, it's where the eyes bulge outwards.
Bulging eyes. Wow.
Yeah, it's caused by inflammation and swelling of the tissues behind the eyes, and it gives the eyes this really wide staring look.
I can see how that would be alarming.
Yeah, it's definitely a noticeable symptom. And people with hyperthyroidism might also notice a rapid or irregular heartbeat,
Okay.
unexplained weight loss, even though they're eating plenty, increased sweating, thinning hair, and even changes in their bowel habits.
Oh, wow. So the effects can be pretty widespread.
Yeah, it can affect a lot of different systems.
What are the treatment options for someone with hyperthyroidism?
Well, there are a few different approaches, and it really depends on the individual and how severe their condition is.
Okay.
Medications can sometimes help control the overproduction of thyroid hormone.
Okay.
And then there's also radioactive iodine therapy.
Radioactive iodine, that sounds intense.
It is, but it's actually very effective treatment.
How does it work?
Basically, the patient swallows a capsule or a liquid that contains radioactive iodine,
Okay.
and that iodine is then absorbed by the thyroid gland. And the radiation from the iodine actually destroys some of those overactive thyroid cells.
So you're kind of shrinking the gland down?
In a way, yeah. You're reducing its ability to make too much hormone.
Interesting. Now, what about surgery? Is that ever an option for treating hyperthyroidism?
Yeah, in some cases, surgery might be recommended.
Okay. In what situations?
Well, sometimes medications just aren't effective, or there's a concern about potential complications from the overactive thyroid. And in those cases, a surgeon might remove all or part of the thyroid gland.
Oh, wow. So it's a pretty big decision.
It is, but it can be a very effective treatment option.
It's amazing how the treatments for hypothyroidism and hyperthyroidism are so different.
Yeah, they really are. It all comes down to whether you're dealing with too much or too little thyroid hormone.
Now, what are the risks if someone doesn't get their hyperthyroidism treated?
Untreated hyperthyroidism can be pretty serious. Over time, it can weaken the bones, increase the risk of heart problems,
Oh, wow.
and it can even lead to a life-threatening condition called thyroid storm.
Thyroid storm, what's that?
It's basically when the body's systems go into complete overdrive because of the excess thyroid hormone.
Oh, wow.
Yeah, it's a very serious situation that requires immediate medical attention.
So again, early intervention is key.
Absolutely. It's important to catch and manage these thyroid imbalances early on to prevent those long-term complications.
Now, before we move on from the thyroid gland, I want to touch on those parafollicular cells we mentioned earlier.
Right.
Those are the cells within the thyroid that make calcitonin, right?
That's right. They're kind of like the thyroid's little helpers.
So what exactly does calcitonin do? What's its role?
You know, that's actually a question that has puzzled scientists for a long time.
Oh, really?
Yeah, it's a bit of a mystery. We know it's produced by the thyroid, but its exact role in humans isn't totally clear.
So it's kind of a mystery hormone.
In a way, yeah. What's interesting is that people who have their thyroids removed don't usually need to take calcitonin replacements.
Really?
Yeah, which suggests that it might not be absolutely essential for our day-to-day survival.
That's so strange. So why even produce it then?
That's the million-dollar question. But we do know that calcitonin has a pretty powerful effect on our bones.
Our bones?
Yeah, at high doses, it can actually help protect bones from breaking down.
Oh, wow.
So it's actually used as a treatment for some bone disorders like Paget's disease and osteoporosis.
So it's like it has this hidden talent.
Haha, yeah, you could say that. Like a backup singer who suddenly gets thrust into the spotlight.
That's a great analogy. Okay, so we've got this somewhat mysterious calcitonin hormone being produced by the thyroid,
Right.
but there's also another set of glands that play a really important role alongside the thyroid,
Yeah,
right?
you're talking about the parathyroid
The
glands.
parathyroid gland.
Yeah, these tiny but mighty glands are all about calcium balance.
Calcium balance, okay?
They work really hard to make sure we have just the right amount of calcium floating around in our blood.
So where are these parathyroid glands located?
They're actually right next to the thyroid.
Oh, they are.
Yeah. They're these tiny little glands, usually 4 of them,
Okay.
located on the backside of the thyroid gland.
So they're like the thyroid's neighbors?
Exactly. Tiny but mighty neighbors.
So why is calcium so important?
Calcium is essential for a whole bunch of things. Nerve impulses, muscle contractions, blood clotting, even bone health.
Use pretty vital.
Oh, absolutely.
Yeah.
Without the right levels of calcium, our bodies just wouldn't function properly.
And these tiny parathyroid glands are responsible for keeping our calcium in check.
They are. And they do it through this hormone called parathyroid hormone, or PTH. Yeah, you can think of it as a master conductor, constantly monitoring those calcium levels and making sure they stay in a healthy range.
Okay, so what happens when our calcium levels get too low? How does PTH step in to fix things?
All right, so PTH has this 3-pronged approach to getting those calcium levels back up.
Okay.
And it's pretty amazing, actually. So first, it targets the bones.
Our bones.
Yeah, because our bones are like our calcium storage unit.
So it's like withdrawing money from a savings account.
Exactly. So when calcium is low, PTH stimulates these special cells in the bones called osteoclasts.
Osteoclast.
Yeah, and those osteoclasts break down bone tissue and release calcium into the bloodstream.
So it's like making a withdrawal from our calcium bank.
Exactly, a calcium withdrawal.
Very cool. What about the other strategies that PTH uses?
Okay, so next up, PTH heads to the kidneys.
Our kidneys.
Yeah, because remember, they filter our blood.
Right.
So PTH basically tells the kidneys, hey, hang on to that calcium. Don't let it go to waste in the urine.
Oh, so it's preventing calcium loss?
Exactly. It's all about conservation,
Howard.
making sure we're not losing any precious calcium.
Smart. What about the third strategy?
Okay, for this one, PTH actually teams up with vitamin D.
Vitamin D?
Yeah, you know, the sunshine vitamin? Well, vitamin D is really important for helping us absorb calcium from the food we eat.
Oh, we didn't know that.
Yeah, so PTH basically boosts vitamin D activation,
Okay.
which in turn helps us get more calcium from our diet.
So it's a team effort, huh?
Absolutely. Release calcium from the bones, reclaim it from the kidneys, and boost absorption from the gut.
PTH is like a calcium superhero.
Uh-huh. It really is. And, you know, it's a perfect example of how interconnected everything is in the endocrine system.
Yeah, all these different glands working together.
Yeah. The thyroid and parathyroid glands may be small,
Mm-hmm.
but they work together to make sure all these vital bodily functions run smoothly.
This has been an incredible deep dive. So much information about these tiny glands.
I know, right? They're more important than most people realize.
Now, I know we're running out of time, but there's one more thing I want to touch on before we wrap things up.
Okay.
It involves both the thyroid and the parathyroid glands, and it can actually be pretty serious if it's not treated.
Ah, you're talking about multiple endocrine neoplasia.
Multiple endocrine neoplasia, or MN, right?
Exactly. It's this rare genetic disorder.
Genetic.
Yeah, and it can cause tumors to develop in several different endocrine glands,
Yeah.
including the thyroid and the parathyroids.
Oh, wow.
Yeah, it can be pretty complicated.
So it sounds like MNN is a topic that deserves its own deep dive.
Definitely.
But for today, I think we've covered a lot of ground with the thyroid and parathyroid glands.
We have. We've gone from the basics of how they work to what happens when they go wrong.
It's been fascinating. And you know what? I think we've given our listeners a lot to think about.
I agree.
So why don't we take a quick break and then come back to wrap up this episode of The Deep Dive.
Sounds good.
Stay tuned. Welcome back to The Deep Dive. We've covered a lot of ground today, all about the thyroid and parathyroid glands.
We have. It's pretty amazing all the things these tiny glands do.
It really is. So before we wrap things up, let's go over some of the key takeaways for our listeners, just to make sure everyone's on the same page.
Exactly.
So what are the most important things to remember about the thyroid?
Well, I think the biggest takeaway is that the thyroid is like our metabolic control center.
Okay.
It produces hormones that basically dictate how our cells use energy.
Right. And that affects so many things.
It really does. Everything from body temperature to heart rate to even how quickly we burn calories.
It's like the thyroid is setting the pace for our whole body.
Exactly. And it's important to remember that it doesn't work alone.
Right, we talked about that feedback loop.
Exactly. It's part of this complex system that involves the pituitary gland and the hypothalamus, and they're all constantly communicating and making adjustments to keep those hormone levels balanced.
It's like a finely tuned machine with all these different parts working together.
It really is.
Yeah.
But as we discussed, that balance can get thrown off.
Right, that's when we see problems like hypothyroidism and hyperthyroidism.
Exactly. And both of those conditions can really impact our health in significant ways.
So it's really important to be aware of the signs and symptoms.
Absolutely. Catching those imbalances early can make a big difference.
Yeah, early diagnosis and treatment are key to preventing those long-term complications we talked about.
For sure. So if you're feeling tired all the time or cold or noticing changes in your skin or you're having trouble concentrating or gaining weight for no reason.
It's worth talking to your doctor about the possibility of hypothyroidism.
Absolutely. And on the other hand, if you're feeling super anxious or jittery, or your heart is racing, or you're losing weight without trying.
Or noticing changes in your eyes.
Right. Those could be signs of hyperthyroidism, and you'll want to get that checked out as well.
So listen to your body, pay attention to any unusual symptoms, and don't hesitate to reach out to your doctor.
That's great advice. It's all about advocating for your own health.
Absolutely. Now, shifting gears to those parathyroid glands.
Okay.
We learned that they're all about maintaining calcium balance.
Right. They're like the calcium guardians, making sure we have just the right amount for everything to work properly.
Exactly. And they do that through the action of parathyroid hormone.
PTH. It's pretty remarkable how it orchestrates the movement of calcium between the bones, the kidneys, and the intestines.
It is. But just like with the thyroid, if PTH levels get out of whack, it can cause problems.
Right. Either too much calcium in the blood or too little.
And both of those can have some pretty serious consequences.
Yeah, so it's important to be aware of those potential issues as well. Things like fatigue, muscle weakness, bone pain.
Kidney stones.
Right. Those are all things you'll want to bring up with your doctor.
It's all connected. Well, I think we've given our listeners a lot to think about today.
I hope so.
This deep dive into the world of the thyroid and parathyroid glands has been fascinating, hasn't it?
It really has. These tiny glands really are endocrine powerhouses.
They are. And knowing how they work and how they can affect our health is empowering.
Absolutely. Knowledge is power when it comes to our health.
I couldn't agree more. So keep learning, keep exploring, and keep asking questions.
That's what it's all about.
Well, on that note, we'll wrap up this episode of The Deep Dive. Thanks for joining us.
It's been a pleasure. Thanks for having me.